Good afternoon, everybody. Welcome to the webinar today. And the webinar today is around the Health Risk Screening Tool, or the HRST, as we also call it. As Kat just shared, these webinars are recorded and made available for folks who want to go back and review, or for folks who can't be on the live version. And with that being said, I just got an email today, somebody asking me how you get there. So I'm just real quickly going to run through that process. If you will start on the DD landing page and click on the Community Supports tab. Under that tab, you're going to come across Education and Learning. And under Education and Learning, you find Webinars. And on the webinar link, you are going to find information about current webinar events, past webinar events. On that link, there is a little box that shows up, and there are recorded webinars from several years in the past. You can review back and look at those. You can look at what's coming up. The upcoming webinars are on there as well. So the Everything webinar is on that page, and we will put that link in the chat for you as well, so it's easier for you to get to. But they are a few steps to get there, but they are on the webinar side. So, and it looks like Kat put that in there. So great. Thank you so much. All right. So getting back to the webinar for today, we're going to start off with quick introductions. You're going to hear an overview of what HRST is. We're going to talk about how it's going to be used. We'll share what individuals and families can expect from the implementation. So I'm going to start us off with introductions. I am Lisa Nodhouse. I'm the Supporting Families Lead with the Division of DD. I actually began working as a parent policy partner several years ago with the Rolla Regional Office, and I have now worked for the division for going on 17 years. My husband and I have 2 adult children and 3 grandchildren, and our youngest daughter has developmental disabilities, and she's the reason that I got involved in the DD systems here in Missouri, and she definitely keeps me grounded. So now that I've aged myself a little, Leslie, I'm going to turn it over to you for your introductions, and I'll let you take it from there and get us started with HRST.
Thank you so much, Lisa. I appreciate you inviting me, and I appreciate you all joining us today on this webinar. And I hope that you come away with some information and more maybe understanding or knowledge about the health risk screening tool, or HRST process. My name is Leslie DeGroat, and I am a registered nurse, and I've been in the healthcare field for 30 years. I started off in dietary. I've been a certified nursing aide. While I was going to college for something totally different, I decided to switch gears and become a nurse. And I have been a nurse ever since. And I just love it. But I also want to say I have been with the division for the past 14 years, and I just love what I'm doing now. I'm serving as the division's clinical coordinator, and I just feel so lucky to be able to serve in that way. Excuse me. So as Elisa said, I'm going to give you an overview on the Missouri Division of Developmental Disabilities Health Risk Screening Tool. That's a mouthful, isn't it? But simply said, we just say the HRST process. So you may hear it called just HRST, and that's the same thing. And we're transitioning to that statewide. You might also hear it called MODD HRST, but HRST is HRST, and it's a screening tool that we're going to start using to better identify where people have health risks and also be able to put supports in place. It'll help us flag where we need to talk about supports and different things that could help individuals served. And it's replacing what we have right now is called Health Inventory Planning System, or HIPS. So that HIPS will be after next year. We won't have that anymore. We will just be looking at HRST. And anyway, I'm really glad to be able to talk to you all about it and let you know kind of what to expect. And I'm gonna go to the next slide. Bear with me here. I'm kind of clunky. Okay, so what is the HRST? The HRST is a tool that is used to provide early detection of health risks and destabilization. Different people who have different health risks or behavioral risks or what have you, that can increase a person's chances of having to go to the hospital or having just really bad outcomes. So our goal right now is to be proactive and really see where people might need some support, and then talk with the people, families, caregivers about that, and just see if that's, does this plan sound okay? Is it okay if we put supports in place here? It is all in an electronic system. So you'll log, the people who use it will log into their computer, and it's in an electronic system. And the first step of the process is, if you have residential services, a nurse will sit down with you, and maybe a direct support professional who knows you well or works closely with you. Caregivers, guardians come to the table. The different questions will be answered related to, eating, ambulation, maybe if different disease processes, if a person might have that. So the completion of that screen, it'll be in the system, and it'll give a healthcare level, which we'll talk about later. And it also houses where the nurse or whomever's doing the screen, it could be a support coordinator if the person is now as a waiver non-residential participant. So they'll complete the screen, and they can complete what's called health risk support plans. And those are plans where the people sitting down with you and going through can say, okay, what applies to the individual? All right, do they need someone to kind of sit with them while they eat? Do they need someone to prepare them their food? And it's supposed to be all lined out in a simple fashion. So if I needed someone to help me and come in to my home, and they don't know me that well or maybe at all, they can look at that health risk support plan and know exactly what I need, and they can pick it right up, look it over, and help support me so I can be successful and healthy, and they know what to expect. And then with the individual and caregivers participating, it's a team effort. So the individual and caregivers, the individual especially gets a say in what kind of supports, and so it's kind of like an understanding and a team effort. Just so you know, the HRST will be completed during the month of the scheduled ISP meeting. So not the implementation month, but it's supposed to be completed a couple months prior to, and it's during that planning month. And it doesn't have to be at the planning meeting, but we're asking that, it's supposed to be done during that month. So if my ISP plan implements, let's say in February, then my support coordinator or my oversight or residential RN will meet with me and my direct support professional or my family, and we'll complete that screen in November. That way it's completed in plenty of time to be ready for the ISP. It just we have a kind of a timeline there, so that way nothing gets forgotten about during, for the ISP, because it is part of planning and putting supports in place, that ISP. So it's kind of a build up to that piece. I'll go to the next slide. So who does the MODD HRST process apply to? It applies to individuals receiving 1915C home and community-based waiver services. So the division has 4 waivers in Missouri, and their community waiver, comprehensive waiver, the Partnership for Hope waiver, in Missouri children with developmental disabilities or MOKIDS waiver. And so it applies to all of those. So if a person is receiving funding through DMHDD through these waivers, then this will apply to that person. And that's, like I said, it's to help identify risk. And we would like to be able to provide any kind of education, training to individuals served, their families, caregivers, just whoever's important to that individual that's part of that individual's team, so that person can be happy and healthy and as successful as they can, let's see. We're also working to also bring a dignity of risk framework to all of this. And remember that the people we support should have a balance of what is important to them as well as what's important for them. And they have just as much a right to live a life that is pleasing to them just as we do. Anybody else who's not maybe receiving services is what I mean. And that's actually a whole other presentation that you'll probably be hearing more about. I have colleagues that are working with information about dignity of risk.
So Leslie, this is Lisa. I had a question the other
Yeah.
day. just want to clarify that you do not, the individual that's receiving waiver services does not have to be living in a residential setting. They can be living in their natural home and also go through the PERS process, correct?
Yeah, thanks for clarifying that. Yes, that is correct. If they're receiving any kind of waiver service, it will apply to them, and it's different than what I understand from typical. So if they're seen by a support coordinator and they have their quarterly visits or what have you, the support coordinator will arrange with the individual receiving services, and then whomever's important to that person, or whomever is applicable, and they'll complete the screen and the health risk support plans, so that it's a team effort, and the individual and their family and caregivers and everybody can have a say in it. But yeah, that's correct. It'll apply to everyone. So yeah,
Okay.
yeah. Thanks for the question. That's kind of confusing because it is different from what I understand about people who've been providing support coordination for a while. They said, well, we haven't had a health risk tool for many years. And so we're hoping that it really helps people so that they can catch. And I'll just tell you one thing why I think this is important. Sorry for the topic, but I read, I'm on a mortality review committee. So if someone receiving services in residential passes away, I look at the case along with the team. And there's different instances where you see where, oh my gosh, if they would have thought of this, or if they had such and such put in place. I mean, I know to hindsight's 2020, but I really think this is going to be a really good tool to help identify things before they get to where, the person's health, does, become unstable, or they do have to go to the hospital. It's just the little things. And I don't know if you guys ever heard this before. And I used to think when I was many moons younger, oh, I'll be okay. Oh, they'll have a cure for it by then. But now it's like, man, an ounce of prevention, what is it? An ounce of prevention is worth a pound of something or other. I don't remember how that saying goes, but I'm just like, heck, if we can prevent anything or keep people stabilized and from getting to the point where they need to go to the hospital, I just think that's a good thing. As you guys do too, I'm sure. Um, let's see. Oh, let me get back to I'm gonna look at my notes again. Sorry, I'm getting on a tangent. There is a bonus feature. I think it's a bonus in this system. If I go to rehabilitation or have employment services, and maybe I'm with my service providers there all day, maybe they notice that I'm more tired than usual, or maybe I can't even hardly keep my eyes open, and they just think that's really bizarre. And maybe they aren't really sure who to report it to. So they'll have access to log in the system just on the people they support, and they will be able to send a message to, if the person has an RN that works with them, or their support coordinator, or another team member who could kind of see about them and be alerted to the fact that this person's tired, and maybe there's something going on with them. It's just another way to kind of facilitate communication between different parties, because as you all know, communication is key. And um, the people who it's the people who are spending time with each other know each other, and they can recognize that stuff, and we just don't want anything to go unnoticed. That's why we're trying to have the team effort for doing the screen and health risk support plans, because like as a nurse, I myself, I used to support people and out in the community and such, and I relied heavily on the direct support professionals or family members or whomever to let me know different things about the person when I come to see them, because just I didn't see them all the time, right? I was by no means any expert, so just having the different perspectives um is kind of, that's the why behind that, just having the different perspectives so we don't miss on some important clues in supporting people. Well, I'm getting long-winded. I'm sorry, guys. Let's see. I still got 15 minutes, but also I don't want to stifle you from asking any questions. Please, if something comes up and you think of something, don't hesitate to pop that into the chat, or guess that's the process. Let's see. Oh, I need to hang on just a second. Can't remember if I showed you the last slide. So why is the Division of Developmental Disabilities initiating the process? Just like I said, to identify risk and try to support people as best we can. And really, we're obligated, the Center for Medicaid Services, or CMS, we're obligated to ensure that participant health and welfare are at the top of our priorities, and that we're making sure that we're doing what we can to help people be healthy and safe. And so this is a big part of that, trying to keep us in line to where we're doing what we're supposed to and what we promise that we're going to do. Um, and let's see. So in information, as I said, it'll be in the system and it'll be accessible electronically to just the identified team members. It's not going to be like everybody's going to be able to log in and look at everyone's information. It's just to the specific team members who on a need to know basis. It's not going to be, it's very protected by HIPAA. I want to emphasize that's we're very mindful of that too. I'm going to go to the next. Now I'm going to go to the next slide. There are 5 categories that are in the screen itself. Under functional status, it talks about eating, ambulating or walking, transferring, which means moving from a bed to a wheelchair or to the toilet, things of that nature. It covers that, and it kind of talks about what kind of support. It asks questions about what kind of support the person might need there. Then it has a behaviors section, and it covers self-harm, aggression. If a person takes medications for behavior, you probably hear it called psychotropic or psychiatric medications. That's also factored in there, because that does have some, tend to have a bit of risk associated with it. Physiological, that has to do with gastrointestinal. Maybe a person might have seizures, that's factored in there. And bowels, especially constipation, bowel obstruction, different things like that. It'll signal things like that because that can pose a increased risk for that person. So that falls under there. And then safety has to do with falls or injuries, things of that nature. That's factored in. And then frequency of services, that factors in if the person has to go see different specialists for different things, that's just not routine, or if they've had to go to the emergency room or the hospital, that factors that in. And so it factors in, and it's got a logic built to it. And I'm telling you guys, I am not a technical person or IT or whatever, but they've built some logic into this to where it will come up, it'll weigh out all these risks, and it'll make a overall score for that individual. And it's been around for quite a few years. It was developed in the 90s, and I believe 25 states are using it right now. But Missouri we've built upon it. That's where we wanted to go a step further, because it's not like show me the proof. In my opinion, it's like we're showing what we can do with this and really do the best that we can. So we added those health support plans and some other features because we thought we're gonna take it one better or two better. We're gonna do the best we can, get the best bang for everyone's buck. So the rating scale, each of the items that are rated, it has a kind of a scoring system where maybe they never have that issue. They haven't had it the past 12 months. And then it goes all the way up to a 4, which is that could be potentially life threatening, or maybe it's something that life defining, which I take it as to mean it changes your life, or your life kind of has to adapt to whatever the issue might be, or if it's caused a hospitalization. So it kind of balances out all these, different scores to come up with a healthcare level. And I'll show you what that looks like. That's what the healthcare levels are. Ones and twos, very, low risk. The person may have just, not too much health wise or behavioral wise, going on, just kind of routine. Moderate risk or high moderate risk. I found it fascinating because the moderate risk individuals who have that level, they may fly under the radar, and you might, like, I had a nurse who's been using this. She was in the pilot group and has been using this screening tool on individuals in her caseload for about 2 years now. And she says it helps her not be complacent. Like, and I know that I've been guilty of it back in the past, and I'm glad I'm learning, because you might say, oh, that person, oh, they've had that. They're doing fine. They do fine with it. But you know what? Have you really looked at it? Have you really put supports in place to keep them at that level where they're stable? I can't think of a good example right now, but that just resonates with me when that nurse said that, she's like, it keeps me on my toes, because there might be things a person might overlook or just not think about. because those 3s and 4s, they're just operating day to day, but they have a lot of health issues that could destabilize them. And then you have level 5 and 6, and those people have high risk, and you're probably alerted to, yeah, they have maybe a lot of medical or behavioral needs. And so you're spending a lot of time with them, trying to help them, support them and help them be healthy and happy and safe. So this just really kind of points that out, so that we can support people better. And I'll tell you why it's also important. Anyone who scores a level 3 or higher, our regional office nurses they'll come into play in this. They'll do an outside review on things. We've got different systems put in place to where different sets of eyes are looking to make sure that we're capturing what we need to capture to keep people safe and supported. Let's see. Let me go to the next slide. I'm getting a little windy here. I'll try to wrap it up soon. I'm sorry. I enjoy talking about HRST. So the health risk support plan, we kind of talked about it a little bit, and it's in this system. I was in a work group and we worked on this, created templates so that the people could go in and either the support coordinator and the individual and their family and caregivers, or if they're residential, it would be the RN that goes in and enters it with the individuals, caregivers, direct support professional that knows them well, and check off what applies. Like if they need someone to sit with them while they eat, and maybe they eat very fast and they're a choking risk, so they do need someone to sit there and cue them to maybe chew slower, take a drink between bites, things of that nature. It'll spell it out for in this document, so that way it'll be housed in the system, but it could be printed off and used for training purposes, so people know just what they need to do to support the individual, keep them safe. Let's see, I'm going to go to the next slide. Okay, so and then as I was talking about earlier, Missouri kind of took it a little bit further, and we created the health risk support plans. And if a person has residential services, their RN will do their monthly documentation in the system, and they'll also have what's called nursing delegations, and that's like a task that is usually done by a nurse, but the nurse weighs it out and thinks, okay, can this person be trained to do this in my place, and can I monitor them and make sure that they're doing a good job? So that will be housed in the system. There's also an enhanced training library, so any training that we do, it will stay in. Like my library is full of trainings, and anyone I do, it will stay in there and I could go back and look at it. Plus, I think this is really good, and I'm very happy about it. They have an hour-long one for any user who gets access, and it's called the Fatal 5+1, which sounds kind of scary, but there are 5. If you detect it early, or even you could even prevent it, but there are 5 common things that can cause a person to end up in the hospital or pass away, sadly. And then there's also +1 that people that they have added to this. It's the Intellectability company created it, but it's things like dehydration, seizures, sepsis, bowel obstruction or constipation, aspiration and choking. And then the extra one is GERD, or that gastroesophageal reflux disease. It seems like just so many people have that and suffer from that. So it talks about these 6 items. And so that way they can whoever gets access to this can have that knowledge to be looking out for that. Because I mean, if we can prevent that, I mean, just think of how, keep people out of the hospital. I mean, that wears a person down. So just getting that education out there. And we're also trying to, well, we're doing it. We're not really trying, but it just seems like things take a little while. But there's an advanced training like that's just for nurses that we're going to be deploying. So the nurses who are in the system looking at, going to the residential service sites and seeing about people, they'll have that advanced training. So they'll have, it'll be bolstered, and they'll be able to really pick up on things. Like there were things that I learned through my years of being in developmental disabilities nurse that I thought I knew, and then whenever I went through this training, you learn something every time you take it, I tell you. So I find it very valuable, and I'm excited that we're getting it to where more people can utilize it and help people. Let's see, we're also incorporating person-centered thinking into what we're doing, so that it's about the person, and it's with the person, and it's not just us doing things for the person and not including them. We want the individuals we support to be included in it, to be about them, not without them. And then another factor is the expanded clinical reviews, which I kind of talked about, where the regional office nurses will do their little extra review whenever people have a certain score, just to make sure we all have our ducks in a row. Because it's a lot, and a person's health, no matter what you're doing, it's like we're all a puzzle, right? So the more we can kind of get a hold on the different pieces to the puzzle, and make sure we have supports in place, the better, I think. Okay, I'll try to get through this. I'm sorry, guys. Data gathering. This is going statewide. Right now, people could come on a voluntary basis. Support coordinators, when their agencies decide, they can start doing the screens with non-residential waiver participants. Residential provider agencies can go ahead and start screening their people that they're supporting. It goes mandatory in May. So I just want to let you know that next May in 2023, it'll be mandatory for everyone, and everyone will have had a screen by that following year. So May of 2024. So I really, I apologize. I've been talking your guys' heads off and not really, let's see. Oh, there's a question in the chat. Oh, is the HRST process going to ultimately replace the ISP, since it will host all of the person's information? That is an excellent question. I'm glad whomever asked it. That is a very good question. The health information will replace the healthy living portion of the ISP. There will still be an ISP, but the healthy living section, it'll be the health or support plans as an attachment, as well as a medication list and a diagnosis list. It'll have all of that included, but it'll be just like, it won't have to be embedded in the ISP, but it will become a part of it. I hope that answers your question, but that's an excellent question, because it all gets kind of confusing. I'm excited. The more data we get through this system, I work in central office and I have a team, and we are able to look and see where the needs are and try to figure out, get a hold of trainings, or try to implement different things to just try to help people out there who are out there, and person might need information on, like, if there's this certain disease process is super common, we can provide maybe some education or training or information on that. Or honestly, I think the sky is the limit at this point. And so I just see us being able to do so many things to help people live the best lives that they can using this. I'm very excited about it. And we're pretty much we only have 2 minutes left, and I apologize I didn't quite get through my slides, but there wasn't really, here, I'll go ahead and click through. I'll come back anytime if you guys want me, but I was just kind of looking at healthcare level distributions, and we only have 243 people screened so far. But I thought that was interesting. There's only about 3% that are scoring a 1, and then about 15% scoring a 2. I really thought there would be a lot of 5s and 6s, which 5 is a good level there. But you see, there's a whole bunch there in the 3 and 4, which is the moderate risk level. And then I just kind of parsed it out. Eating distribution, people pretty much, according to this, most people needed some kind of a support during eating. There was about 39% that didn't, so over half. All these over here needed some level of support with eating. And then, as I said, the providers can start screening at any time. So I just wanted you all to be aware of it, and I'd be glad to talk more about it or answer questions. I can is it okay if or do you put things in chat? Here's what our website looks like. We have a website dedicated to the Mo Health Risk Screening Tool project. And I don't know, it's like right on time. I'll turn it over to you, Lisa. Thank you, and I'm sorry for running to the end there.
Oh, no apologies. Real quickly, you have an email address that if folks have questions, they can email you, or email to the inbox, and it will get answered, correct? The MoDD
Yes.
at dmh.mo.gov. I put that in the chat.
Oh,
if there's
you gotta stick a project in there. MoDD HRST project. Here, I'll put it. Hang on.
okay,
And don't feel bad. I've done that before a million times. Okay. Yeah.
okay.
Please reach out with questions if you'd like to learn more about it. Just you can reach out through that email, and my colleagues and I watch that email, and we'll get right back to you.
Leslie, you do have a question. It's just really quick, yes or no. It's
Oh, yeah.
asking, the person is asking, did you say this goes mandatory in May of 2023 or 2024?
Oh, it goes mandatory in May of 2023, and everyone will need to have been screened by 2024, May of 2024. So 2023 is the starting date. Hope that was clear.
Yeah, and I don't know if you shared that already, but I'm gonna go ahead and add in the website for the first page that we have on
Oh,
the.
thank you.
So there's that. And if you will just advance to the next slide.
Oh, sure.
Yeah, and I'm thinking we maybe need to fix that email address there.
I didn't even, that's funny. I
Yeah,
didn't even catch it when I looked at the slides.
Not a problem.
Wait, I'm probably I'm the one that did that. Sorry.
We had one
sorry,
more.
guys.
We had one more question pop up.
Oh, okay. Is it do the individual have to have a waiver service to get the rating? Yeah, it has to be, the person has to have a waiver to get the rating. So yeah, that is true.
And Leslie, we'll fix that on the PowerPoint that Kat will post on the webinar page. We'll fix that address so that it's accurate.
Thank you. I
No
apologize.
No problem. If you'll just click to the next one, I just want to thank everybody for coming today, and go ahead and mark your calendar for the next MoDD and U webinar, which will be on November 22nd, which is going to be right before Thanksgiving. So join us again, 12:30 to 1 on the 22nd of November. Thank you, everybody. Thanks, Leslie.
Thank
Appreciate it. Lots of good information.
Good. Thanks for having me. You guys take care.
Thanks.
Bye-bye.